is an important topic to anybody who's considering moving here as an expat. Tonight, I want to give an overview of your healthcare options as a foreigner considering moving to Costa Rica. Good evening. My name is Matt Rosensteel, and tonight, as always, is our live Costa Rica chat with Costa Rica Matt here Wednesday, February 16th, 2022. I want to talk about healthcare because, frankly, it's a topic I haven't addressed, I believe, since 2018. And really, it's one of the most important questions that I get a lot from potential real estate clients moving here. Obviously, Costa Rica is an important destination for retirees and people considering moving here in somewhat later stages of life. And for those people, it can be extremely important to understand what options they're going to have for healthcare here in Costa Rica. Second of all, they want to understand what the public healthcare looks like here in Costa Rica. They want to understand what private options they have. They want to understand the costs. And for many people, they want to understand what kind of insurance options they have in terms of policies that will protect them from huge costs after they've moved here. We'll go over this all tonight. Thank you very much for joining me here. It's going to be a very fun ride this evening, folks, because rather than having my typical support staff with backup and a producer, it's going to be just me, so we'll try and make do as best we can. As a reminder, I'm live every Wednesday night at 7 p.m. Costa Rica time. Sometimes it's 7:02 or 7:03. That's 8 p.m. Eastern right now in the first half of 2022. And if you have questions or comments that you want me to try and address, please do leave them in the comments section here or even in the live chat replay. We will be addressing those questions in our last Wednesday night every month. So you can leave your questions, and even if I don't get to them tonight, we will try and make sure they are handled by the end of the month. Before we get started with our discussion tonight of Costa Rica healthcare, I want to give you a brief overview of our experience personally. My wife and I moved here together in 2011. It wasn't more than 2 or 3 years before we had our first major health emergency, or rather a health emergency that required a trip first to a public hospital and later a surgery at a private hospital. My wife then underwent 2 childbirths in private hospitals here. In subsequent years, I've had stitches a few times, so I've gotten off lightly so far in terms of my interaction with the healthcare system. But primarily, my goal is to provide straightforward information so that you can understand what you're looking at as a foreigner, possibly moving here, and whether or not you're going to have healthcare that's adequate for you as a foreigner here in Costa Rica. Again, my name is Costa Rica Matt. Thanks very much for joining me tonight for this Costa Rica chat. Good evening again, folks. Thank you for listening in on this discussion of Costa Rica healthcare. And do be sure to post your questions, comments, and concerns in the comments section so that we can get to them either tonight or eventually at the last Wednesday night chat of every month. My name is Matt Rosensteel, and I'm so happy to see Claude, Steve, and Didier also joining me as well for this discussion of the healthcare system and specifically what healthcare options, how things relate to foreigners in particular. Before we get started, again, I wanted to mention we have not been entirely separate from Costa Rica's healthcare system since we moved here in 2011. I personally, during my 2 years as a volunteer living here, actually ended up with very little contact from 2008 to 2010. Anne Marie and I came down together in 2011. A couple years later, I think in 2014, Anne Marie had an accident and broke both of the major bones in her lower leg. That required a very exhilarating trip to a public hospital late at night, as well as some follow-up surgery. Later, and I want to show some amazing pictures, we enjoyed our 2 childbirths in Costa Rica. Let's go ahead and embarrass my son way ahead of time. In 2015, Jonas came into the world in the Liberia private hospital, SEMA. Later, we had our second son, Daniel, in a different hospital, also private in that area. And so we've had plenty of interaction over the years with Costa Rica's health system. To get to our first question tonight, what options are available to foreigners, people considering becoming expats in Costa Rica in terms of healthcare? And it's very important to understand that you have access to both a public and a private system in Costa Rica. Yes, this country very much celebrates the fact that they have universal health care for the population. They very much also have an inclusive healthcare system that treats anybody showing up at the doors of hospitals for emergencies, and according to certain criteria, will also treat conditions that permanent residents have here in the country, whether or not they were born here. The public Costa Rica healthcare system, to go back to our anecdote about Anne Marie's accident, even if you are not a resident here, and even if you don't have health insurance, Costa Rica's public system will treat you as a foreigner, and the cost will still be extremely low. We had to make an emergency room trip for a broken leg and ended up seeing just how unbelievably low this cost was. I remember the morning after Anne Marie had a cast, an orthopedic surgeon look at her leg, and a couple of others, an x-ray, a night in the hospital, all kinds of services. The cashier at the hospital was embarrassed when I told them, I don't have insurance here yet. I'm not a resident. Let me know how much I owe you for the bill. And for that night, for that x-ray, for the consultation, for a cast, we owed at the time about $200, paying 100% out of our pocket without any insurance or access to the public healthcare system's finances here. So that, to begin with, was incredible. This was not a situation where, as uninsured foreigners, we had an accident that resulted all of a sudden in some enormous financial liability. Instead, we had an incredibly small bill. Now, what's this downside of the public system, and what's the other side of the story that I'm not telling there? Yes, the night in the hospital, Anne Marie spent actually pretty much in a hallway where, they do not have a large quantity of rooms for people recuperating in beds. And those rooms oftentimes have 8 to 10 patients in them, more and more if you get in bigger hospitals. Private rooms don't happen in the public hospitals here. You get stuck in public areas, and very often these public hospitals don't have the capacity to provide a super comfortable experience for the people who are going in. I remember, we took care of the emergency. It was fine. But, I ended up sleeping very much in a waiting room, Anne Marie in a hallway, I think for several hours until the orthopedist came in the morning. Her only medicine was very strong, the equivalent of aspirin, essentially. In public hospitals here, there's no food service. Families are expected to provide food for their loved ones, except in certain situations. You'd find that the conditions in these public hospitals and in public clinics are not as comfortable as what you'd expect as a US or Canadian citizen. Although, frankly, I haven't been in a hospital recently in the US or Canada, and I've heard some pretty negative things about conditions there as well. But the long story short is that you can expect there won't be Ritz-Carlton level service standards at a Costa Rica public hospital. Again, even as a foreigner, before you have your residency, they will take you in and treat you. And I'm willing to say that the public health system here has decent emergency services to the level that you need to save you and to make a major repair in an emergency. These public facilities may not be places you want to spend a long time recuperating, but absolutely, if you need to get a massive cut taken care of, broken bones, emergency situations, Costa Rica public hospitals, generally speaking, can take you in and take care of you. And really, in those emergency situations, that's where they thrive and where they're as close to US or Canadian standards as you might find. As always, my experience is based here in Guanacaste, the northwestern part of the country, where now we have a decent level of population, development, infrastructure, and the Costa Rican government has been investing resources in the health system here. I am sure that there are corners of the country, if you're in the deep southeast near Panama, or the deep southwest on the other side of the country in the Pacific, or remote islands on and on and on. Costa Rica does not have the resources to get decent public hospitals into every community. You would find that out of every 3 or 4 counties in rural areas, there's a good public hospital and some satellite facilities that also can provide emergency response. I say every 3 or 4 counties, so there are 83 in Costa Rica. I'm talking about the cantones. And when I think about that situation, I think of, for example, Nicoya, Santa Cruz, and Nandayure, 3 counties here on the Nicoya Peninsula, where, yes, in Nicoya, you have an excellent public hospital, one that just received a huge infusion of cash from the national government. Excellent in the sense that, yes, public hospitals still have huge restraints. They're always going to be bureaucratic and difficult to get through. But in Costa Rica's system, one of the hospitals that's been updated recently and that very much is performing as high as they can. So you've got one great public hospital in Nicoya, and surrounding counties have to gravitate to that public health facility in order to get their services. And so if you're living here in Junquillal and you wanted to get a public hospital option, yes, it'd be about a 45-minute drive. If you're living even further south of us in Ostional and you wanted that access to that public hospital, it could be even further. And really, those major public hospitals are scattered throughout the country in a density that wouldn't necessarily mean that no matter where you are in Costa Rica, oh, no problem, there's a hospital right around the corner. That's not true whatsoever in the public sphere. And if you're considering investing in one area of the country or another, it is worth looking into what public health facilities are available there so that you get an idea of all of your options in an emergency. Where could I run and how close by is it? As a foreigner, obviously you also have access to private options here in Costa Rica to move on. Private hospitals and services in the country are incredible for a number of reasons. One being that the amount of regulation, insurance, et cetera, that they have to comply with is far less than private health services in other parts of the world. And you would see that as a result, they can provide services pretty cheaply. Private hospitals and clinics and specialists, this alternative system that is in Costa Rica is absolutely limited to areas where there is enough demand for these services, period. You will not find private hospitals throughout these rural provinces where, yes, Costa Rica life is absolutely idyllic and you can get back to the rainforest. But frankly, if there aren't enough patients in a given area, then no one is going to be able to afford to open a hospital. In Guanacaste, again, the northwestern corner of Costa Rica, we have probably one of the largest concentrations of private health services, specifically because we also have one of the largest concentrations of foreigners moving here. You also see an extremely large concentration of private health services in Costa Rica's Central Valley, that middle urban area with San Jose, Cartago, Alajuela, Heredia, four Costa Rican cities concentrated in a city in the Central Valley. You also get a ton of access to private healthcare there, not just because there are plenty of foreigners, but absolutely because there are plenty of Costa Rican citizens who can afford those services in the Central Valley. When you move out to Guanacaste, when you go out to the Caribbean, when you go to the South Pacific, there are very few areas where there would be enough people who can afford private health services to justify them. As a rule of thumb, if you're looking in an area as a foreigner that might only have a couple thousand people living in it and really a town that feels isolated from a major tourism hub, you're probably not going to have access to a private facility above any kind of first response, first care clinic. I'm thinking of towns, that are 45 minutes to an hour or more away from the tourism hubs that include Coco, Tamarindo, Jaco. On the Caribbean, really it'd be tough to find one single place where there might be a private hospital. On our coast, the Pacific, if you want to find this kind of service, you definitely have to be close to a tourism hub, because in between, in those areas where there isn't a large concentration of people, you're only going to have access to the public healthcare system. Let's quickly touch base on that public system again and look at a bit of history and sort of what it looks like in rural Guanacaste, which is most relevant to me. I've lived near Playa Junquillal, a very small community, since 2008. Costa Rica's government made an amazing effort to get small clinics into every single rural town in the 80s, 90s, and 2000s, to where you saw that even in my 360-person Peace Corps site, the community of La Florida de Santa Cruz, they had a local healthcare facility that is called an EBAIS, or EBAIS, if you're sort of pronouncing it in English, EBAIS. You still see EBAISs throughout the country, EBAISs. It was really charming when I first moved here. This facility in my tiny town was literally a 15-foot by 20-foot simple building on the side of the soccer field, where once a month a local Ministry of Health team would arrive to do their appointments and basically do their primary care with all of the, especially elderly in town. They'd take people that were sick and kids, etc. But really, it was a routine circuit, and they had people out on these circuits constantly. You would see tiny, tiny villages 20 years ago that had their e-bikes, where a doctor would come once a month, take a look at what was going on and give them prescriptions. as part of the National Health Ministry's care for the population. That's absolutely been diminishing with time and really retracting. Whereas you used to have these clinics in towns as small as 350, 60 people. Nowadays, they've closed all of those facilities in most areas, or at least in this area of the country, and the health ministry has started concentrating their efforts on larger local facilities. For example, whereas we used to have it in a 350-person town, now all of those small villages in our area that have 300 to 500 people living in them have to go about 15 kilometers up the road to a 2,000 to 3,000 person town, what is our district capital, 27 de Abril, to get their health clinic. It's still a very vibrant system where you see that the health ministry has in districts throughout the country, and districts are a political division below cantones. You've got 83 counties, and then I don't know how many districts, but cantones are divided into them. In our county, I think there are 10 or maybe 11 districts. Anyhow, you see these health facilities now retracting into major areas and really the extent of them going decreasing. Costa Rica still provides 100% universal health care for its citizens, and they have to pay every month a premium into the Social Security system, whether it's their employer paying it or whether they're paying it as an independent employee, or in some circumstances, they're not paying it and they have to instead rack up a debt that eventually they either try to repay or sign up for a repayment program, sort of extending the credit, etc. The Costa Rica public healthcare system is very much having financial problems. You never see that their budget is balanced, and annually they're requesting financial support from the national government to make ends meet. In a perfect system, they would be paying 100% for themselves. This is not a perfect system. It's far from it. And the debts that they have been accumulating with time. To touch quickly on the private system or the extent of it and the facilities that you'll see throughout the country, you can depend now that if there is an expat community that's growing quickly and if there's a lot of people moving in, there's very likely a local private healthcare clinic available to offer primary care and even a rotation of specialists in your area. For example, in Tamarindo, in Hacienda Pinilla, a gated community, in to think of other places, Reserva Conchal, another huge gated community. There are first care, primary care facilities for expats and those private options that would be very comfortable and catering to expats. They would have bilingual employees and really be able to take care of your day-to-day needs. You would see that most of those small clinics that are even located in gated communities or bigger expat areas do have an emergency room. I've never had to try exactly how extensive those emergency services are in those small clinics. Personally, I've gotten stitches twice in those smaller clinics. And for stitches, it was absolutely fine. They had 2 small operating rooms, very much the level of comfort and equipment. Everything felt like I was in an absolutely modern clinic, etc. I don't know that they have defibrillators and really the surgical equipment to help somebody through an absolutely major emergency. But in expat heavy areas where you've got good development, I guarantee you will find a friendly local clinic that can handle everything up to stitches very cheaply and also in with bilingual doctors, nurses, etc. There are also private hospitals in Costa Rica, though those are very limited. And even in Guanacaste, you see that they struggle to maintain that business model. There was a private hospital where our first son was born, Jonas, which was called SEMA. That hospital had maternity services for only about 6 to 8 months. And then they had to shut down their maternity offerings because there were not enough people in the area signing up for it in Liberia that made it worth their while. SEMA, I believe, is still open in Liberia. There's also another hospital, San Rafael del Arcángel, a private hospital right in downtown Liberia that is exemplary of smaller private hospitals that you'd find. They only have 8 to 12 beds. The hospital itself does have an emergency room. And again, I feel that they have very extensive services available. They're far better than the emergency rooms available at that sort of beach community level. Still, I don't know if I would go in there if I had had an absolutely massive traumatic event happen to me or one of my family. But they have pretty extensive services with this small dozen-bed hospital right in Liberia. And one of the wonderful things is that they do have a rotating schedule of specialists. And you would find this throughout the country that whereas, yes, they have their emergency room open 24/7, and they do have doctors on hand immediately to handle primary care needs, you can also get access to healthcare, your skin specialist, all kinds of different, niches for doctors once a month or once every 2 weeks at your local private hospital. They'll be coming through, and they always ensure to have a rotation of different kinds of doctors coming through so that they can serve a wide variety of patients. You will have an audiologist, your ophthalmologist, and your whateverologist, again, on a every 2 or 3 or 4 week basis coming through that you can go visit, set up an appointment, and get in and out to get something specific for yourself checked through this private system. So really, if I were a foreigner looking at Costa Rica, I would feel extremely confident that I have facilities available to me to handle whatever size of the emergency I was dealing with. If it were a small emergency and I had time to feel comfortable, I'd immediately look to the private system. If it were a larger emergency and I needed the closest available healthcare, I would look for the closest available healthcare, even in the circumstances where those private hospitals don't necessarily have the capacity to take care of a full-on traumatic situation. They can stabilize you, do something, and get you in an ambulance driving very fast to the next bigger facility. And many of the private facilities here will even have helicopter access to get you to a larger hospital down the road. Lisa had an excellent question. Can the smaller facilities handle things like heart attacks? And it's one that, to be honest, I don't think I can answer. If you have a heart attack and you show up at a smaller private facility in either Guanacaste or another part of Costa Rica, I guarantee that they can do something, whatever that initial step of treatment is, and that, yes, they will take whatever steps they can to get you stabilized and headed to a facility where they can fully take care of you. I was talking to the doctor giving me stitches, in this tinier facility, and asked, really, do you guys have huge ordeals? Do you see major accidents and traumatic events? And she said, yes, we do. Absolutely. We do the best that we can, and we try and get people headed in the right direction. Most of the time, these facilities are dealing with routine patients coming in because they have a scheduled appointment or a small emergency. I would say that in most large emergency circumstances, it's almost always worth it in Costa Rica to head straight to a major hospital rather than stopping at a small clinic in the hopes that they can actually do something. I had another experience with a friend who had fallen off a horse riding. Her head had split open from one end to the other, and we went to the public system. And it was great because great. I'm sorry, that's a very weird word to use, but we went to a local clinic in the public system where we essentially wasted our time and stop. The nurses there were really only authorized to sort of put bandages and pressure on her wound. And we just sat and waited for an authorized ambulance to come and pick her up and go to a bigger hospital, when really, since we had been in our own car getting to the first hospital in the first place, we should have just beelined it directly to a bigger facility to begin with. And thank goodness she wasn't in any mortal danger. But once we did get an ambulance, we had to go to a bigger hospital and really get stitches. And private versus public, in any situation here, you're going to be weighing your distance to a particular facility and the level of the emergency. So it's going to be tough. There are situations here where locals will even call an ambulance driver that they know well and say, I'll meet you at this or that midway point on the way to the hospital, to try and make things as efficient as possible to get someone out to where they need to be. I think very often, and one of the biggest differences here in Costa Rica, you're not going to see a 15, 30-minute response for ambulances everywhere in the country. In downtown San Jose or in Atenas, those areas in the Central Valley, I'm sure they can get you an ambulance lickety-split. If you're in Hacienda Pinilla or one of these places with the emergency facility, yes, an ambulance is going to be very quick. But for a lot of us living in quiet rural communities or between areas with major medical facilities, the best bet in any emergency situation is going to be to have someone drive you in the direction of the facilities you need immediately, rather than waiting for emergency responders. That's not really a point I planned on touching on, but you see that a lot of people here end up driving themselves to hospitals because, yes, the delay that an ambulance would take to get from its nearest facility to you can oftentimes be something that you didn't need to wait on. And instead, somebody could be getting you out to a hospital as fast as possible. And that can be your absolute best bet. Steve, that's an excellent question as well that I'll touch on at the end here about COVID and how it's impacted the healthcare system. First, I want to touch on costs in Costa Rica and how much you can expect to pay as a foreigner here. The short answer is a fraction of what you would expect to pay for healthcare if you live in a private system like the United States of America. We did a brief amount of research here to give some exact line item costs. But for example, a visit to our local doctor for any one of our family members, Jonas, Daniel, me, or Anne-Marie, that primary care visit here through a private clinic only costs $40. A dental cleaning for either a kid or an adult, and here they get to use that new ultrasound technology, and they've got really good dental machines because dentists aren't restricted as much as they are in the US. A dental cleaning only costs you $50 whether you're a kid or an adult. A cavity will cost you between $40 and $60 as well. Again, through private care where you're just paying out of pocket. If you want to see one of those specialists I talked about, a skincare specialist, etc., it can be between $150 and $250. You can get laser skin treatment up to 5 different spots zapped for $100 here in Costa Rica. And that's just beginning. Those are basic absolute services. I thought it was funny. I wanted to find out what something a little bit more serious would be. I called Hospital San Rafael in Liberia, and I wanted to ask them what it would be to get my appendix removed. And I wanted to show this video, first of all, not only to show that it's going to be extremely cheap and prizes to those who can hear what the cost is, because this is a conversation in Spanish. But also I wanted to show you just how simple life can be with a private healthcare system here. I call somebody at the hospital implying that I need to get my appendix removed, and they give me a figure, I think, less than a minute and a half into the stream. This is the hospital's automated message. Muy buenas tardes. Nada más quería preguntar por el costo de sacar el apéndice de alguien.
Una cirugía de apéndice anda alrededor de $8,500.
¿Cuánto?
$8,500.
8,500. Muchísimas gracias. ¿Por ser adulto o niño?
Pues eso ya queda valoración médica. Ya tienen un diagnóstico confirmado de apéndice.
No, bueno, no está con... That's the call just went there where the guy was asking me whether or not we had a confirmed diagnosis that someone needed to get their appendix removed. Did anybody hear the cost there? A surgery to get your appendix out in Costa Rica, whether it's child or adult? $8,500. Which I don't know the current ongoing cost in the US, Canada, etc. if you were to call a private clinic and just ask to get your appendix removed. But that's the total all-in cost that the guy gave me over the phone in less than 2 minutes. When Anne-Marie had our 2 babies in private hospitals here, 7 and 4 years ago, respectively, they each cost about the same amount. Jonas was about $8,000 and Daniel $7,000. For Jonas, we spent 2 nights in the hospital. Anne-Marie had 2 epidurals, and we even had the next day a dinner brought to us, actually, as we were sort of checking out of the hotel. I'm sorry, I was out of the hospital. It's amazing. So this was our private room where Jonas had been born, where we were paying under $8,000 for the total experience. Interestingly, I want to see if anybody notices just exactly what the hospital brought us in the background there, along with 4 glasses. It's interesting to see. They brought us a bottle of rosé the day after Jonas had been born. They took our orders. This was after 48 hours of an experience where Anne-Marie had nurses checking on her more frequently than I can describe, where we had doctors that were essentially only in the hospital because of her case, and where we received treatment that was absolutely caring and focused on us. Because again, in that experience for Jonas being born, we were in Sima, another private hospital in Liberia, where there are probably only 8 total beds. And again, we paid $8,000 for one childbirth, or 7 for one, 8 for the other. Anne-Marie had also got her, when she had her double knee, the 2 bones in her leg break, she had a pin placed from her knee down to her ankle That surgery cost us about $7,000 as well. Now, granted, that was about 10 years ago, and prices have certainly gone up from now since then. But I've heard American doctors tell us that the piece of equipment that was put in her knee, costs that much money in the US. Some of these surgeries, a birth, an appendix getting removed, etc., can cost you tens and tens of thousands of dollars, where here, through private healthcare, you can be paying under 10 for a lot of different procedures. And it's pretty impressive just what the low cost can be when in a system that isn't horrendously burdened by all kinds of layers of cost. Finally, let's talk about insurance. Can foreigners get it here in Costa Rica? And the answer, once again, is absolutely yes. You can have insurance through the national healthcare system. If you become a permanent resident here in Costa Rica, or if you become a resident through any one of the programs, you will be required to become part of the national healthcare system. That's a requirement that's been in place since 2010. To give you an idea, my family, being permanent residents, is paying a monthly premium to have access to Costa Rica's universal healthcare system. Our premium is about 65,000 colones, or the equivalent of $105, maybe $110 per month. That amount that you pay into the system, the CCSS, your insurance requirement will be based on the program you come in as a foreigner, your income, etc. You can also find a lot of private insurance options here in Costa Rica. Blue Cross Blue Shield offers policies for foreigners who are here. There are a range of providers available. One of the most notable is Costa Rica's semi-national, semi-private institution called INS, or INS. INS was absolutely a government institution for decades and decades, became semi-private somewhere along the line when Costa Rica had to liberalize its economy in order to comply with CAFTA. And today, INS does provide private health insurance policies, but only to permanent residents, foreigners that have gained that status here. I asked for a policy quote for my family of 4 people, 2 37-year-olds, a 7-year-old, and a 4-year-old, as to how much it would cost us annually for medical coverage that would keep us covered in private clinics as well. And we got a $5,500 quote for the annual cost of an insurance policy that would cover up to $2 million in health insurance costs. Again, that's $5,500 for our family of 4 to have a private policy. That $5,500 policy would be about $500 a month. My national insurance, the public healthcare system, is costing me closer to $100 a month. And to be honest, looking at how our family is and what our future holds, knocking on wood, like many foreigners, it makes a lot of sense to not have private insurance here, because the premiums at $500 a month stack up pretty quickly. And in fact, when you think about the fact that it cost us $7,000 for a childbirth, or $8,000, it becomes quickly difficult to justify paying $5,500 a year to have access to those private healthcare facilities in order to be able to be protected against those emergencies, because those emergencies, those huge treatments and catastrophic situations. Personally, as someone who's lived in Costa Rica now for 15 years, I feel that the Costa Rica public healthcare system can handle a lot of those. It won't be perfect if we ever need to treat a chronic condition, or, for example, one of the most important things here that you see happening with people getting their appendix treated. The public healthcare system here can be really bad if you're waiting and seeing and hoping. And for example, they will decide to postpone treatment too long. Those emergency situations where it's absolutely clear what needs to be done, yes, public hospitals can cover you. And for those catastrophes, I feel confident turning ourselves over to the Costa Rica public system. For private healthcare here, the insurance premiums to have access to it, and really the cost when you get down to actually needing their services means that frequently it can make a lot of sense for foreigners not to have any kind of insurance here and instead pay out of pocket for private medical services as you go. Because again, that primary physician visit only costs you $40, a dentist $50, getting your cavity between $40 and $60. Really, you can get a lot of services much more affordably here in Costa Rica than in other countries. I want to go back. I had promised to address a question about how COVID has impacted Costa Rica's health system. And very much, Steve, you saw that during the peak of the COVID crisis, or rather the moment when the most people were in hospital beds and intensive care units in Costa Rica, there was a huge impact here because this is not that big of a country. I think at one point, the number of intensive care beds in the country was somewhere between 600 and 800 as sort of the baseline number for how many hospital intensive care unit beds there are. And when we started seeing significant numbers of COVID cases, yes, there was a huge issue where those intensive care beds filled up. The government raced to respond like many did internationally. They set up temporary facilities. One of the major things that they did here that I think is kind of interesting, that their approach, many of the regulations that Costa Rica, or the restrictions that the Costa Rica government passed in order to restrict people during COVID, were not necessarily only intended on stopping the spread of COVID, but many times the Minister of Health here was very clear about the fact that they were trying to stop other kinds of emergencies. For example, the driving restriction, where from 8 p.m. until 5 a.m., for many of the months of the pandemic, in fact, I'm not sure if it's still in effect, you were not supposed to drive without due cause between those hours. And very much what they were trying to do was to limit traffic accidents that occurred in those hours, because traffic accidents at night are a significant reason that those precious ICU beds were filled up here in Costa Rica. And so at the same time, the impact here in the country was not necessarily that we never saw the health system break down or really end up in a chaotic, totally collapsed situation. Instead, you saw both the government, from one side and the other trying to manage the crisis to keep it so that we had some access to ICU beds. There were points during the pandemic that you saw services delayed to Costa Ricans. And in fact, going back to that point I made about, in the public system, as long as you don't need something, urgently, and as long as it's, if in an emergency, they will handle it if you're bleeding right then. If you need an appendix out, and it might be sort of a, 50-50 situation, or for example, if you have a cancer and you're trying to get treatment for that, public system isn't great on moving fast. And in fact, it's atrocious at moving quickly, I think many could say. During COVID, they were unable to move even as quickly as they normally do, and there were even more significant delays for surgeries and all of the procedures that people were sort of lined up for nationally here in Costa Rica. Currently, you see the healthcare system in good shape overall. because it does seem that, yeah, Omicron isn't sending as many people to the hospital as previous variants. Another great question that we received that I hadn't considered addressing was whether there is a 911 type service from Claude. Yes, there is 911 in Costa Rica, no matter where you are or when it is. There's a 911 operator available to talk to you. They speak English, in fact. When you dial 911, the first option will be whether you need English or not. Again, 911 service here is great in that they will immediately answer. They'll take down what's going on, and you actually have great customer service there. I found that they're extremely punctual. What won't happen so quickly is the ambulance that you need if you're waiting on an emergency response in a very rural area. Out here, it could be an hour, it could be 2 hours. I don't know how long an ambulance would take after you had called and said you needed one. People here do use 911 a lot for health emergencies. You might see them coordinate and say, hey, I've got, this emergency. I'm driving to Nicoya. I need these people to be ready when we get there. You'd also see people call 911 and say, I want to meet the ambulance wherever they are. You would infrequently see people calling 911 with a health emergency, asking for assistance and hanging up the phone outside of those urban areas where they could actually expect a quick response for sure. Another good question, are the public hospitals and facilities air conditioned? And this is one of the things that's been changing rapidly over the years. 10 years ago, very few were. And in fact, you hear legendary stories of people, imagine going through labor in an unair conditioned public room with 10 other people. I had a friend who also, their wife was giving birth in a public hospital. They didn't have access to hot water. There was one shower for all of the 10, birthing women to use, and the hot water turned off. I would guess that most public facilities are now air conditioned in their emergency rooms and a good number of their recuperation rooms. The outside areas, the hallways, the waiting rooms, on, generally speaking, they're not air conditioned. I am sure that in the country there are still hospitals out there where they don't even have air conditioning in their emergency room or the recuperation rooms. But in many of the facilities, you will see that they've achieved a decent level of comfort in terms of AC. A good example being our Nicoya Hospital. They recently, like I mentioned, received a huge infusion of cash from the Costa Rica government to build the medical tower, which I think is just sort of a new building. This tower, the foreigners who had visited it since it opened were all remarking, wow, that is 10 degrees more comfortable than the old public hospital. They do have AC. They did have great beds. I felt very comfortable there. And Costa Rica is doing this transformation throughout the country. I'm sure that the government has a priority for areas where those health facilities are most used, the population density. The cynic in me would say that they're probably trying to upgrade their facilities in the areas with foreigners to try and have a popular international image. But long story short is that the public facilities are becoming more comfortable. Most often you'd find that, yes, they have AC, but you might also find that you have AC for the first 2 days while you're sort of under intense scrutiny. And then, for the rest of your stay in the hospital, if you need an extra week to get back on your feet, you might be in an unair conditioned space with your family bringing food for you 100%. I'm very appreciative for everybody tuning in here. If you haven't already done so, be sure to subscribe to my channel. It's just a couple clicks. You can hit that notification bell so that you see when I post extremely juicy real estate opportunities here in Costa Rica. Do be sure to stay tuned every Wednesday night, 7 p.m. Costa Rica time, 8 p.m. Eastern currently, for my live chats with more straightforward Costa Rica information. As always, thank you very much for joining me. This is Matt Rosensteel signing off for tonight. Pura vida.